Imagine living in a place where zip codes predict life expectancy better than genetic codes, where untreated cavities are the leading cause of school absenteeism, where nearly half of people over age 30 have gum disease, where poor children die from untreated tooth decay. You don't have to imagine it. You live here. But our focus is not on what's broken in America's healthcare system. Ours is a story of solutions. We invite you to learn about a dental education and care delivery model that has been an enduring success for 5 decades in the United States. A program that helps improve lives here and can be replicated elsewhere. Whether as a resident, faculty member, clinical training site, or grantor, we invite you to join NYU Langone Dental in our mission to impact the hidden healthcare crisis in America: oral healthcare. The postdoctoral dental residency education model that started as Lutheran dental medicine was created by Dr. Neil Demby in 1974.
Dr. Demby was ahead of the curve. Not only did he see the need for affordable, quality dental care, he was able to do something about it.
Dr. Demby combined postdoctoral dental residency training with society's mounting need for affordable, quality dental care.
It is a win-win-win situation for the residents, the patients, and the health centers.
It's a win for dental residents because they're able to make a difference in people's lives while getting unparalleled clinical experience in a tuition-free program that pays a generous stipend. Patients win because they access the impossible dream: free or low-cost quality dental care right in their own community. And training site partners win because they keep the revenue generated by resident-performed procedures. NYU Langone Dental currently operates 7 postdoctoral dental residency programs. There's no shortage of reasons why dental graduates looking to advance their education are passionate about our program. With more than 340 sites in the U.S. and abroad, ours is the largest postdoctoral dental residency program in the world. Our residents can choose to train in rural towns like Bessemer, Alabama, remote locations like Juneau, Alaska, urban areas like Brooklyn, New York, suburban cities like Tucson, Arizona, and urban university settings like San Francisco.
I really didn't want a 5th year of dental school. I was adamant about it. I was ready to get out of school, ready to live my life, but this has been the best thing I've ever done.
A robust clinical curriculum comprises 75% of a resident's total experience. This translates to incomparable hands-on training in which residents complete as many as 2,500 procedures per year in close mentorship with world-class attending faculty.
There are standards that we have to meet that are part of the Commission on Dental Accreditation, or CODA. And some of those standards state that, a resident needs to do 20 OR cases to graduate. In our case, many of our residents are doing 90 to 100. The CODA standard states that the resident needs to do 25 sedations to graduate, and many of our sites, our residents are doing 65, 70, 80 sedations.
We want them to be able to be smooth with exodontia, take out almost any tooth easily, proficiently, with good patient experience. We want them to know molar endo, something they typically don't learn in dental school, and there's a lot of need for that in private practice. We do sedation, IV sedation, and then the CEREC unit.
What they're doing prepares them in ways that no other residency program can to be successful once they finish the program.
We do a lot of Canberra, we do a lot of gum grafting, surgical implants, non-surgical implants. Thursdays we get to work with a cosmetic dentist, and Fridays with a prosthodontist, so it's a really nice, wholehearted program.
The didactic training portion of our programs are delivered via acclaimed distance learning technologies, linking all training sites, regardless of geographic location. Residents collaborate with their colleagues in real time. They can also self-engage in learning and relearning at their own convenience.
The stipend goes a long way to help us. The amount that I'm making here as a PGY1 resident is the same amount that I made in my entire year of private practice in Los Angeles as a general dentist at a community health center.
It was more than enough to cover my cost of living. I got to start paying back a little bit of my loans. And so it really helped.
I probably have 2 to 5 dentists call me a month and say, hey, I need somebody to come work in my office, but they want our people. They want our graduates.
About 35% of our graduates are offered and accept staff positions where they're trained.
I was a resident here, and I didn't even know that community service existed, that you could treat patients, underserved patients, and be a dentist in an environment other than a dental office. I felt that I was doing something that was significant and important.
Our postdoctoral residency programs have helped to close the dental divide for millions of adults, and countless children too. Millions of people without the means to otherwise access dental care have been treated by our residents since 1974. During the 2016-2017 residency year, over 691,000 individual patients receive 1.8 million treatments and procedures. Today, more than 3,000 dental professionals around the globe have something very special in common. They are members of an elite group of highly trained generalists and specialists.
I have made friendships and working relationships with people I graduated with or have met subsequently that lasted years. I mean, it really has enhanced my personal life, my professional life, way beyond my wildest dreams.
Our graduates become confident practitioners with bright futures in private practice, community and public health, specialty training, and academic dentistry. The poor state of oral health care in America is called our hidden health care crisis for good reason. It's not talked about much. But be assured, the dental divide separating those who can afford to take care of their teeth and gums and those who cannot is acutely felt by millions of people every day. People in communities where we live, in towns we drive by on our way to work, and in many places we may never visit.
I have to say that I go to bed at night feeling good about what we do. While I may have the vision and the ideas, the people who are in the field execute it. And they execute it beyond what my expectations are and have been.
My passion is finding ways to provide dental care to anybody that needs it. Zero disparities, care for everybody. It's why I do this work, and I think it's why they do it too.